Myself Dr. Deepika Saini from Lloyd Institute of Management and Technology. Now, we are going to study the second part of parasympathatomimetic agents of Unit 3 Medicinal Chemistry 1 BP 402T. So, in the last lecture, here is a very quick revision of parasympathatomimetic agents that we have studied, that these are cholinomimetic agents or the parasympathatomimetic agents, and these are the drugs which are cholinergic in nature, and hence that will produce the action similar to that of the acetylcholine, but the point is we need an action with a greater extent in the case of cholinergic drugs. So, when we classify these parasympathatomimetic agents, we have one is direct acting agents, another one is indirect acting agents, and another category is cholinesterase reactivators. So, first of all, the direct acting agents. Direct acting agents, it contains acetylcholine, the directly associated with the acetylcholine, Carbacol, bethanacol, methacholine, pilocarpine. And when we talk about indirect acting, these are of two type, one is reversible, another one is irreversible. So, reversible indirect acting agents, the example of in reversible indirect acting is physostigmine, neostigmine, pyridostigmine and adrophonium chloride. And when we talk about irreversible drugs, irreversible indirect acting agents, these are isoflurane and parathione, malathione. These are the important drugs of irreversible indirect acting agents. Further, another topic in parasympathatomimetic agent is cholinesterase reactivators, and pralidoxime chloride is an example of this category. So, first of all, let us start with direct acting agents. As we have already studied, the cholinergic drugs, these cholinergic drugs have two receptors to act on. One is nicotinic receptor, another one is muscarinic receptors. So, these are the direct acting agents. They will directly bind to either to the nicotinic receptor or to the nicotinic receptor or to the muscarinic receptor, and will produce the action similar to the acetylcholine. So, first of all, we have taken the example of acetylcholine. Acetylcholine is the neurotransmitter that is being released. So, this is the direct acting drug, but the point is it will metabolize through the cholinesterase enzyme. As we have studied in the metabolism of acetylcholine, the cholinesterase enzyme will metabolize acetylcholine into acetate as well as in the acetate part and the choline part. And further, when we talk about the uses of acetylcholine, it is used in as eye drop to cause the miosis during the surgery. Apart from that, they are also used as the vasodilators or the cardiac depressant that we have already studied. The sympathetic has an effect of increasing the heart rate. Rather, this parasympathatomimetic or the cholinergic drugs, they are well known for their action on heart as decreasing its effect, like they are also known as cardiac depressant. Next is Carbacol. Carbacol will the next drug is Carbacol under the category of directly acting. Directly acting means they will directly bind to the muscarinic or the nicotinic receptors. It is not inactivated by the cholinesterase enzyme, because cholinesterase enzyme acts on the acetylcholine for the breakdown, for the metabolism of acetylcholine by hydrolyzing it. So, when we talk about the Carbacol, it is not inactivated by cholinesterase, it will not be hydrolyzed by cholinesterase, then definitely it will possess prolonged action as compared to the acetylcholine. So, it will remain in our body for a longer period of time. And basically it is used in the case of chronic glaucoma. So, glaucoma is a condition where there is increase in the intraocular pressure. So, to decrease that, we use this drug Carbacol. When we talk about other effects, it also produces the miosis and it also reduces the post-operative risk. In the synthesis of Carbacol, we have seen here this is 2-chloroethanol. 2-chloroethanol is reacted with urea. 2-chloroethanol, this is 1 and 2. 2 carbon chain means this is ethyl group, this is OH, so this is ethanol. At second position there is chloro, so 2-chloroethanol. It is reacted with urea, that will lead to the formation of 2-chloroethyl carbamate. So, here what will happen, this we have OH here, this OH will be replaced by this NH, NHCOO. So, this is 2-chloroethyl carbamate. By the action of trimethylamine, this is CH3, CH3 and CH3. So, here is 1, 2, 3 trimethylamine. By the action of this trimethyl, now what will happen? Now, this is NH2 and C double bond O, O and carbon, carbon and nitrogen, and that contains the 3 nitrogen atom. So, this is the synthesis of Carbacol. So, this Carbacol is being synthesized through this route by the action of using the reactants 2-chloroethanol and urea, that will lead to the formation of 2-chloroethyl carbamate, and further the action of the trimethylamine comes into play, and that will lead to the formation of Carbacol. Next is Bithanacol. Bithanacol is another example, but this is more selective when we talk about muscarinic receptor, because it has been clearly seen, as we have studied in our structure activity relationship, with respect to the nitrogen atom. This is alpha and this is beta, and we have introduced a methyl substituent at beta position, that will lead to the selection towards the muscarinic receptor. So, in the structure activity relationship in the last lecture, we have studied the same thing, that the inclusion of methyl at the beta carbon atom will lead to the selection towards the muscarinic receptor. And this is more stable as compared to Carbacol, because there is no group present, no methyl group present in the beta carbon atom. So, beta carbon atom, what they are talking about? They are talking through the esteric position, because this is the position that will have more priority as compared to nitrogen, but we have done that structure activity relationship with respect to the nitrogen atom. So, when we talk about this, so if we will consider this esteric group, so this is the alpha carbon, this is the beta carbon. In the Carbacol, we have seen this. In the Carbacol, here we have seen this is esteric carbon. So, this is alpha and this is beta, okay, because there is no substitution at alpha and beta, and hence muscarinic receptors and nicotinic receptor, it can act on the both. So, it is used to stimulate GI tract. If it is stimulating the GI tract, it means it will increase the secretion of GI tract, it will increase the peristalsis movement after surgery, because during the surgery we do not need any extra secretions. So, before the surgery, generally anticholinergic drugs to suppress, to decrease the secretions or the action of the urinary bladder, there we have to suppress their action before the surgery, like atropine is given, one of the anticholinergic drug. So, afterwards, after surgery, we need to stimulate the GI tract to bring again the action that has been already created, to make that action to the normal, so that the patient can eat normally. So, we have to stimulate the GI tract, we have to increase the secretion of the gastric tract. So, it is also used to stimulate GI tract and the urinary bladder after the surgery. The next point is methacholine. So, in case of methacholine, again it is more selective towards the muscarinic receptor. The reason is same with respect to nitrogen, this is alpha, this is beta. Again we have a CH3 group at the beta position with respect to nitrogen, and that will lead to the selection of the muscarinic receptor. That is why it is more selective towards the muscarinic receptor. Again it is prolonged action as compared to acetylcholine. The reason is again same, because it will not be affected by the acetylcholinesterase, hence it will not get hydrolyzed that much rapidly as compared to the acetylcholine, and will remain in the body for a prolonged period of time, and hence possess prolonged action. It is also used in the time of Raynaud's disease and the glaucoma. So, the Raynaud disease is when a person is staying in a very cold place for a very longer period of time. There is specifically in terms of hands, there is vasoconstrictions occur, and hence there is very less flow of blood, hence less oxygen, that will lead to the immobility of these fingers and hands. So, to overcome this problem, what will happen, methacholine that will introduce, we have already studied in the muscarinic receptor, like there will be synthesis of nitric oxide. So, this nitric oxide synthesis helps here, that will this nitric oxide release, that will increase this blood artery, that will dilate these blood arteries in the fingers, and hence improve the mobility of fingers and hands. So, in that case, that highly vasoconstricted blood vessels in the fingers that led to the immobility of fingers, that is a Raynaud's disease. So, it is used to treat that Raynaud's disease and also in the glaucoma, and it is also used in the case of tachycardia. Tachycardia again, it is a situation where the heart rate is quite high, and we have already studied it is cardiac depressant. So, definitely it will decrease the heart rate and serve the purpose. So, methacholine is also used in the treatment of, in the case of tachycardia. The next one is pilocarpine. Pilocarpine is direct acting muscarinic receptor. It is used in the case of glaucoma to decrease the intraocular pressure, and also in the treatment of the dry eye and the dry mouth. So, these are the direct acting cholinergic agents, that is parasympathomimetic or cholinomimetic agents, and we have seen that these drugs are basically more active on the muscarinic receptors, and on muscarinic receptors they are helping in the treatment of glaucoma, or where we need to decrease the heart rate, like in the last case in the methacholine we have seen that they are used in the case of tachycardia, very high rate of heartbeat. And further we have another category, that is indirectly acting cholinergic drug. The first one is reversible. So, they will not directly bind to the either to the muscarinic or to the nicotinic receptor. They are not going to bind any of the receptors. They will act through a different mechanism to possess its cholinomimetic property. Like in the case of reversible, we have various examples. This is the example of physostigmine, and this is neostigmine bromide, and pyridostigmine bromide is also an example of indirectly acting cholinergic drug. Apart from that, we have several other examples when we talk about reversible indirectly acting cholinergic drugs. Another category is irreversible cholinergic irreversible cholinesterase inhibitor. So, as we have seen, when we talk about the indirect acting means they are not again we are specifying again this thing, they are not directly binding to the receptor, either to the muscarinic or the nicotinic receptor to produce cholinergic effect. Rather, they will act on the cholinesterase enzyme and they will inhibit the cholinesterase enzyme. And if we see the cholinesterase enzyme, this enzyme is responsible for decrease in acetylcholine, because it lead to hydrolysis of the acetylcholine. So, when there is a drug that will lead to decrease the concentration of acetylcholine, the enzyme acetylcholinesterase is responsible for the hydrolysis of acetylcholine and hence decrease the concentration of acetylcholine and will definitely act opposite of acetylcholine. So, now what will we do? We will bind to that, and these drugs will act on this cholinesterase enzyme and will inhibit this. After inhibiting this acetylcholinesterase enzyme, less amount of acetylcholine is going to be hydrolyzed. So, there is, after the inhibition, the acetylcholine, the amount of acetylcholine will get increased, and hence through this action these indirect acting drugs. So, when we talk about the reversible, means they will bind to that enzyme reversibly. They will bind and then leave it, but in case of irreversible, they will bind to the cholinesterase enzyme, but will not get detached. So, the example of irreversible cholinesterase inhibitors are malathion. This is an example of malathion. Here we can see like the phosphorus is present. Apart from phosphorus, sulfur is also present along with the ethyl acetate. These are diethyl acetate derivatives, and then parathion. In case of parathion, again we have seen there is inclusion of phosphorus as well as sulfur, and apart from that the esteric group has been replaced through the ether group, and further there is isoflurate. Again there is inclusion of phosphorus and fluorine atom, the halogen atom, and the last one is ecothiopate iodide. Again we have seen there are phosphorus and sulfur. So, when we are talking about irreversible cholinesterase inhibitors, so they are not going to act on the muscarinic receptors. They have their another tendency to inhibit the cholinesterase enzyme to produce either they can be bind either by the reversible process or through the irreversible, but they will inhibit the action of cholinesterase enzyme and hence will produce more will produce, either we can say that will inhibit the hydrolysis of acetylcholine. Inhibition of that hydrolysis of acetylcholine will lead to increase the acetylcholine, and hence the action can be exerted by the acetylcholine. So, let us have a quick revision for the classification part. As the parasympathomimetic agents, we have basically two different category for parasympathomimetic agents, direct acting or indirect acting. In the case of direct acting, we have studied about all of them: acetylcholine, carbacol, bethanacol, methacholine and pilocarpine. And apart from that, we have indirect acting. We have both reversible as well irreversible, that we will study in detail in the next lecture. For the reversible, we have several examples like physostigmine, neostigmine, pyridostigmine, and apart from that, in case of irreversible, isoflurate is there, parathione, malathione, ecothiopate iodide is also there, and in cholinesterase reactivator, that is another example for the parasympathomimetic agents that is included in this chapter, but exactly it is not mimicking the cholinergic activity, but this is also a part of this chapter, cholinesterase reactivator, that is paralydoxim chloride. In the case of direct acting, we have studied first the first compound is acetylcholine. Definitely it is for sure direct acting, and it will act on the both receptors. It can attach to the muscarinic as well as to the nicotinic receptor, and it produces meiosis effect during the surgery, and also the vasodilator and cardiac depressant, because lesser pressure is required, blood pressure is required. In the case of carbacol, both muscarinic and nicotinic receptor again, but it is not inactivated by the cholinesterase enzyme, and hence possess prolonged action. And apart from that, the next is bethanacol. We have studied that the inclusion of methyl group that has already led to the selection of the muscarinic receptor through this drug, and again it can stimulate the GI tract and urinary bladder to maintain the normal situation for the patient after the surgery, because during surgery we do not need much secretion. So, before that anticholinergic drugs were given, so that the GI secretions and the urinary secretion, the urinary bladder secretions can be stopped, can be depressed, but to maintain that again in the normal life. So, we have to stimulate the GI tract. So, we use this drug. The next is methacholine, and it is more selective on the muscarinic receptor. The reason is again the same, the inclusion of the methyl group, as we have studied in the structure activity relationship, and it has again the prolonged action, and it is used in the treatment of Raynaud's diseases. That we have Raynaud disease, we have talked about it, that because of the lesser flow in the fingers in a highly cold places, it happens, like there is immobility of fingers and hands. So, to maintain the mobility of fingers, we use methacholine, that will produce the that will create the mobility in the fingers by the release of the nitric oxide, and it is also used in the case of tachycardia. As we all know, these all drugs are cardiac depressant, so we can use them. And then last one is pilocarpine, which is well known drug for the glaucoma, and also in the treatment of dry eye as well as dry mouth by increasing the secretions. And these are the examples. So, in the next lecture, we will study about the indirect acting parasympathomimetic agents. Thank you very much.